Hello there, hello. Welcome to Guardian Stars platform. I'm your presenter, Mlondano Maybin. In this presentation, I have something very special to talk about. This presentation is important for the school leavers, those who want to become nurses, and those who are already in college. Okay, so basically, I'll talk about the entry requirements to a college and the program structure. Under the program structure, I'll simply talk about how the first academic year will proceed once you are successfully enrolled into a college. Okay, so let's talk about the entry requirements. According to the General Nursing Council of Zambia, the entry requirements to any nursing college are the same for all colleges. What you need is a certificate, a grade 12 certificate according to Zambian setup. You need a grade 12 certificate, and your certificate should have 5 O-level subjects with a minimum pass of a credit. Among the 5 subjects, you should have English language, mathematics and biology as your compulsory subjects, plus any other 2 subjects from the following list: history, geography, chemistry, physics, agriculture science, religious knowledge, commerce, physical science and nutrition. Okay, so one would ask, what is a credit? So according to the Examination Council of Zambia, a credit at grade 12 level is a mark between 50 and 59. So if you pass in any of those 5 subjects with a credit, that means you got a mark between 50 and 59. The minimum entry age is 18 years for school leavers. Okay, so let's talk about the program structure. The program structure is as follows. When you have successfully enrolled into a college, you've been accepted and you are in class now, you are on campus. Your program will last for 3 years. If you are a direct entry, your program will take 3 years. Then if you are an in-service, your program will only take 2 years. In-service students are those students that are converting from enrolled nursing to registered nursing program. Okay, so in the first week of your reporting on campus, you will have an orientation week for 1 week for about 7 days. Okay, so this is a time when the college will orient you to the environment of the college itself and the marketplace. In case you want to buy groceries, in case you want to go to relax, they will introduce you to the social clubs around the market and everything that is important in that environment. Then you have computer and life skills for 1 week as well. Computer skills, at least as a student, you are expected to be able to know how to use a computer, and these are just basic lessons on how you can at least manage to use a computer in order to write an assignment. Okay, to write an assignment or research, just in case you are asked to write an assignment and it should be typed, you should not have a challenge using a computer. Okay, and life skills, of course, as a student you will need to survive and you will need to balance up your life. So these life skills are just it's just a very short course that's going to help you with the survival skills. Okay, it's going to empower you with survival skills on campus, how you will balance up the life of a student. Okay, then you will have your first lecture block for about 11 weeks. This is a period when you're going to be in class doing your theory. Okay, So at this time you start learning all the courses that we already mentioned, the full and the half courses, for about 11 weeks. Then you will have a clinical drills. Clinical drills will run for about 3 weeks. These clinical drills will just orient you to some procedures. Okay, it will be an introduction to how you can perform certain basic procedures before you are sent to the actual ward. So these clinical drills are usually done in the lab that the school has. Okay, in the school lab where you're going to practice most of the procedures on mannequins, the doors. Then you have the clinical practice. Now this is a period where you're going to be attached now to a real health facility. It could be a clinic or the hospital. This time you have a privilege to practice on real patients, on real clients within the clinic or the hospital. And this clinical practice usually runs for 25 weeks. Then you have the second lecture block. Your second lecture block will only be for about 6 weeks. This is after you've come back from the clinical setup. So you'll have to come back for another second lecture block. So with the end of each lecture block, you usually have the continuous assessments. These are tests that you write in each course that you've been learning, so that those results that you get will also be added to your final examination, okay, to determine your progression to the next year, to the second year. Okay, then you have the examinations. Now after the second lecture block, you have examinations for about 2 weeks. So these examinations are the end of year examinations that will determine whether you can progress into the following second year, into the following year or not. Then you'll be given a vacation leave for about 2 weeks, and the total number of weeks that you have to spend in school for the whole year is about 52 weeks. Okay. In your first year, these are the courses that you should expect to have. You are going to have 2 categories of courses. You are going to have full courses and half courses. Among the full courses, you have the following courses: Fundamentals of Nursing is a full course, Anatomy and Physiology, Medicine and Medical Nursing, Surgery and Surgical Nursing, and Pharmacology. These are the full courses. There are about 5. Then half courses, you have Sociology, Professional Practice, Microbiology, Public Health Nursing 1, Psychology, Nutrition and Dietetics, Basic Computer Skills. These are the half courses that you will have as well in your first year. So your first year is going to be divided into 2. You are going to have the first 6 months as your first semester and the second 6 months as your second semester. In your first semester, you will have the following courses: Fundamentals of Nursing as a full course, Anatomy and Physiology as a full course, Sociology as a half course, Professional Practice half course, Microbiology half course, in Public Health Nursing 1 half course, Psychology half course, Nutrition and Dietetics half course. Then in your second semester, you will have Medicine and Medical Nursing 1, Surgery and Surgical Nursing 1, Pharmacology 1, and Public Health Nursing 2. In your first semester, which is the first 6 months, you will also have the clinical practice. In this semester, you're going to have the industrial visits for about 1 week. Then you'll have the clinical drills for 2 weeks. These clinical drills, I think I've already explained them. Then you also have to be allocated to general wards, which is medicine and surgery. wards, surgical wards, okay, for about 10 weeks. Okay, then in the second 6 months you are going to have the clinical drills again for 2 weeks, and you will also be allocated to the general wards for about 12 weeks. Then you will go for public health nursing for about 3 weeks. This is where you are allocated to urban clinics, okay. These are health centers that offer primary health care to the community. So this is all I had for you in this presentation. So in the next presentation, I'm going to talk about the courses in details and what you should expect as you study all the courses in the first year. Okay, please subscribe to our channel and click the alert bell so that you are always alerted when we upload new videos. Thank you so much for listening to our presentation.